think what some of the studies have shown, like for instance in the Keynote-1 study that was looking at pembrolizumab treatment in melanoma, I think one of the things that was found is that in patients who are BRAF metastatic, the response rates for immunotherapy seem to be lower. And it's been hard to say for sure whether that's because BRAF metastatic patients per se have lower response rates to immunotherapy, or whether it's prior treatment with BRAF inhibitors that reduces the rate response. But that's something to keep in mind. I think in patients who are BRAF metastatic, not only do they have this additional option of using targeted therapy, but also to keep in mind that their response rates to immunotherapy might be lower. So that would be one factor to consider, in terms of deciding targeted versus immunotherapy. I think theoretically or scientifically, I don't think there's a lot of reason to think that prior treatment with immunotherapy necessarily lowers the response rate to targeted therapy. We know that BRAF status does not change. And so given the fact that your tumor is not going to change from a BRAF mutant to a BRAF wild type tumor, it seems like you would have just as good a chance of response to a BRAF metastatic tumor following immunotherapy as you would have prior to immunotherapy.